assignment, the key thing I want you to know for a new graduate is straightforward. Okay, they're just coming out from a nursing school. They're eager to learn, but there's steps to taking care of patients. And the whole thing is safety, like I told you from the beginning. So the patient that you assign them to are the most stable patient. You want to give them most stable patient as much as possible. What does that mean? The patient should have a predictable outcome. A patient who has a predictable outcome, you know what is going to happen. That means everything is being done, just a little things that need to be done, and the patient will leave the hospital. So they need predictable outcome. Okay, they should not need any intervention. No intervention, okay, that will require what? Independent nurse knowledge. So they shouldn't have to require any intervention that will require independent nurse knowledge or skills that the nurse has to use, or judgment by a nurse. It shouldn't require anything at all. Judgment by a nurse who's been doing this for a long time. Should not be needing any assessment at all. Should not be needing any teaching at all, and will not need any evaluation at all. And as you can see, this is the it we talked about last time with delegation. So they shouldn't need any evaluation, assessment, teaching, any judgment of the nurse, any knowledge and skill of the nurse. That requires advanced nurse who've been doing this for a long time. So you don't assign a new graduate this kind of patient. It's very straightforward. When you know that, then you use it to answer every question. The patient has to be stable, should have a predictable outcome, should not require any intervention, that will require an independent, that's the key word, independent and nursing knowledge and skills and judgment, independent, that alone can do it. The nurse alone who's been doing it for a long time, and an assessment. A judgment is the assessment. And then there's no teaching involved for a nurse who's been doing it for a long time, or evaluation. And that is the E. The EAT, evaluation, assessment, and teaching. So let me give you an example. As you can see in the question, I always like to use question to explain stuff. So this is an assignment question. Which of the following is appropriate to assign to a new nurse graduate? It's a new nurse graduate. So you're looking for something that has a predictable outcome, is stable, does not require independent nurse and knowledge and skill and judgment. No teaching involved, no evaluation. So basically, no and no judgment, no independent knowledge. Straightforward. So you're looking for that patient, you shouldn't assign them to them. A client admitted with acute MI 1 hour ago. This is admitted 1 hour ago, need a lot of assessment, need a lot of independent judgment from the nurse to do, take care of them. This is not appropriate. A client with hypertensive emergency on IV nifedipine drip. This is a lot of independent knowledge, a lot of skills involved to take care of this drip. The newness may not be appropriate for this. A client with sickle cell requiring frequent IV antibiotic. Every nurse should be able to give it, requiring IV pain medication. This patient, all he needs is pain medication. Any nurse should be able to administer pain medication and take care of the patient. There's nothing that requires independent knowledge, judgment, teaching, evaluation. So this is appropriate for. A client with a DKA is very complex. They need IV fluid, they need insulin, they need their potassium to be checked. They need to be monitored to avoid being in shock or neurological problem, and they become lethargic. So DKA they need a lot of fluid, they need to be monitored. So this is inappropriate assignment. So that's how we can apply such a information for that question. The same thing, one more. The client, which of the following patient is appropriate to assign to a new nurse? The same thing. He and no independent knowledge and skills involved. A client with pulmonary embolism needing teaching. Well, there's teaching here on community. You can't do that. Right now, as a new nurse, it should be done by a nurse who's been doing this for a long time. A client with SIDH with sodium of 110. This is a good one. These patients should be on seizure precaution. It's unstable. That patient cannot be given to. So this patient does not have a predictable outcome. It can go into seizures. So that's not appropriate. A client who just returned from bronchoscopy. Well, it just returned from bronchoscopy. This is an airway issue. They put a scope through the airway to take biopsies. And that patient need to be monitored carefully to avoid any aspiration and other stuff. Need continuous assessment. It's too much for a new nurse, so that's inappropriate. A client who had umbilical hernia repaired 24 hours ago, that patient is stable. It's appropriate for a new nurse. The last one. Which assignment is appropriate for a new nurse? A client admitted for acute appendicitis 1 hour ago. This patient needs assessment, ongoing assessment, be ready for surgery. It's not appropriate for a new graduate nurse. A client 2 days ago after cholecystectomy is really stable. A client 1 hour after tonsillectomy with excessive swallowing. Any patient who has tonsillectomy, you have to know a few things. If they have excessive swallowing, that means they're bleeding. The blood basically go back the back of their throat, so they continue to swallow. So you ask, that sign is a sign of hemorrhage. This patient can go into hemorrhagic shock from excessive bleeding. So watch for this. This is a B sharp patient. You have to be sharp to take care of them. Therefore, it's an airway problem from my B sharp, not expected. So this patient is too complex. A client admitted with CHF and blood thin sputum. That's another airway issue. So that patient is not appropriate for a new nurse. Blood thin sputum is a buzzword for a pulmonary edema. Pulmonary edema. When you see blood thin sputum, that's airway, and it's part of the B sharp, not expected rule for the prioritization. You can check my prioritization video and you will see it over there. So this is not appropriate patient for them. So the appropriate patient is B. So when it comes to room assignment, I always compartmentalize it. You want to avoid infection. That's all. That's number one. Number one, avoid infection. Okay, so anybody that is going to get infected, like post-op patient, somebody who just have surgery right now. So post-op patient, no, don't put it with the patient that will make them infectious. Two, immunocompromised patient. So HIV patient, AIDS patient, somebody on chemotherapy, and pregnant patient who is immunocompromised, somebody on steroid or methotrexate, taking any medication that will make them immunocompromised. Don't put them with patient that will make them infectious. And then two, if you have to put two people together, they should have same, listen carefully, same organism, not precaution. What I mean is you can have a patient, two people who need contact precaution, but the organism is different organism. These people cannot be put together. You have to have what? Same organism, but the precaution doesn't matter. So you can have two C. diffs. Yes, they can be put together. Both of them are contact. You cannot put MRSA and C. diff together. Even though both are what? Contact precaution, the organism is not the same. So you cannot put them together. So once again, for you want to avoid infection, so don't put immunocompromised patient, post-op patient, or with anybody who has an infection. That's number one. Two, don't, if you have to put two people together who have infection, they should have the same organism. So don't put a patient who can get infected, especially immunocompromised patient, with somebody who has infection. And if two people have infection, they should have same organism. And that is all you need to know with assignment, room assignment. If you do that in your head, you can answer any questions on assignment. Use that strategy. So we're going to use it to answer a few questions. So a client with breast cancer on chemotherapy. So this is telling you a patient is getting chemo, is immunocompromised. That's what you have to extract from it. Which room assignment is appropriate? So I don't want to infect this immunocompromised patient. A client with meningitis, wrong. A client with diarrhea due to C. diff, well, he has infection. A client with bleeding from rectum, all he's doing is bleeding. There's no infection. Bleeding, vomiting blood and bleeding, there's no infectious process. They have no todes based on the answer choice, nothing like that. So I'll pick that one. A client with runny nose who tested positive for flu, where it's infectious. So the only person I'll pick is C. So the next one, the same idea. You have a client with HIV CD4 count of less than 200 was admitted for shortness of breath. All this is telling you HIV CD4 count 200. All it means is patient is immunocompromised. I try to put fancy words there to confuse you. But HIV with the CD4 count less than 200 is immunocompromised. Which room assignment is appropriate? Well, I don't want to infect immunocompromised patient. A client with acute diverticulitis with a white count of 16,000, where it can infect this patient. DKA with dehydration. DKA patient has no signs of infection. There are no infectious process, so this is appropriate. A client with sore throat due to adenovirus. This has contact precaution, and we can get infect the HIV patient. A client with wound infection due to MRSA, another contact precaution, it can infect the HIV patient. So the right patient is number 2. So you can see how you can make it easy for yourself. You use a few strategy, and every answer has to be evaluated based on that strategy. And that's how you need to do to pass your exams. I mean, don't make things so complicated. I try to make it easy, straightforward as much as possible, and you can use that to answer questions easily. The same thing. Which room assignment is appropriate? A client with scabies and one with adenovirus. We all know scabies and adenovirus, they all contact precaution. But what is wrong with this? These are different organisms. So even though the precautions are the same, organisms are wrong, are not the same. So it's a wrong answer. A client with strep pneumonia and one with C. diff, the same thing. You have contact precaution here, and this one, they are not the same organism. So you cancel both of them. A client with scabies and one with DKA. Well, DKA doesn't have infection, but somebody with scabies can make the DKA infectious. You don't want to infect that person. So this is inappropriate. So we left with this. Client with localized shingles and one with crusted varicella. If you have localized shingles, all you need is standard precaution. You have one with crusted varicella, person is no more infectious, and therefore you can put them together. So this is the right answer. Same thing. Which assignment is appropriate? Shingles and what? Pertussis. Different organisms, right? And then they different precautions together. You can put them together. C. diff, contact precaution, scabies, contact precaution, but what it is, different organism, different organism. We can put them together. Strep pneumonia and bleeding or esophageal varices. Okay, well, this is as precaution, is infectious process. Esophageal varices doesn't have infectious process, but we can put these two together. There's no way we can put strep pneumonia, they get infected with esophageal varices patient will get infected. Two clients with C. diff, yes. Same precaution, which is contact precaution, same organism. So we can put them together. Now, if you have a floater, this one, pay attention. If you have a floating nest, the key is what? The nest should be assigned non-specialized tasks. So if you go to oncology nurse, go to orthopedic nurse and floor, you shouldn't be doing things that orthopedic nurses do. So they shouldn't be assigned they should be they should be assigned non-specialized tasks. So something that is not they should be assigned a patient that they don't need any specialization for that specific floor. And secondly, it should be routine nursing care. The patient should need routine nursing care, and it should be stable. You put this in your head, you can answer any floating question. It shouldn't be assigned any specialized patient. The patient just need routine nursing care, and the patient should be stable patient. That's all. Therefore, let's see what we can do with that information. So we have a couple of patients. Which assignment is appropriate for a floating nurse from the psychology unit to medical surgical unit? Well, medical surgical unit, they don't do psych stuff. So psych and nurse in the medical surgical unit, you want to make sure you don't assign any specialized surgical patient. All the patient need is routine care and the patient is stable. A client who need discharge instruction for appendectomy, well, they need specific instruction after appendectomy. The psych nurses doesn't know that, so can be assigned. A client admitted 2 hours ago for MI. where 2 hours ago still need a lot of assessment teaching. Is too complex for her. A client with acute ulcerative colitis and a white count of 16. This is acute problem. Ulcerative colitis specific for med-surg. Psych nurse should be seeing that patient. A client with left foot fracture requiring pain medication. The psych nurse should be able to give pain medication. All these patients need is pain medication. So this is an appropriate assignment. Make things easy for yourself. Try to make it easy for yourself by having the target that keep you focused. L&D nurse float to cardiac ICU. Which assignment is appropriate? Where cardiac ICU is a little bit complex. L&D nurse do some monitoring, but we got to make sure doesn't require specialized nurse care, no routine nurse, any require only nurse, routine nurse care, and a stable patient. A client with unstable angina on telemetry, of course. The L&D nurse shouldn't be taking care of an unstable angina patient. This is for a cardiac nurse. Client 2 hours ago after cardiac bypass. This needs specialized care. So the cardiac nurse will do that. So this is inappropriate. A client with MI admitted 48 hours ago and normal troponin. So 2 days being admitted with a heart attack, but all is left at what? His troponin is normal. That means the heart attack has resolved, he's doing fine. There's no evidence of any ischemia again. This may be appropriate for the nurse. All you need is the routine nurse care, no specialized. A client ready for discharge after heart transplant. Well, the L&D nurse doesn't know how to discharge a heart transplant patient. This patient needs specific instruction in terms of medication, what to expect, and the other thing. So discharge should not be given by the L&D. So C is the right answer. So as you can see, this is the way you can analyze questions on assignment, room assignment, floatingness. To assign a patient, make sure you give for a new nurse, most stable patient, patient with a predictable outcome. That means the patient doesn't need any intervention that is will require an independent nurse knowledge, skills, or judgment, or assessment, or teaching, and that is EAT, EAT. For room assignment, make sure you don't make one patient infectious. That means if one patient is infectious, you shouldn't infect the other patient. So don't put an infectious patient with immunocompromised patient. Immunocompromised patient are HIV patient, those on chemotherapy, and those have diagnosis of cancer, those who are pregnant and other things. So you don't put them all those on medication that will make them immunocompromised. Don't put them together. Then secondly, if you have to put two people who are infectious, make sure they have the same organism, not precaution. So they can all be contact precaution, but if it's a different organisms, that means MRSA and C. diff cannot come together. They will cross-contaminate. You don't put them together. And for a floating nurse, you should not assign any patient that require specialized tasks. So they should be assigned non-specialized tasks in the patient. Secondly, the patient should all they need is routine nurse care and a stable patient. So med-surg L&D nurse going to ICU cardiac unit shouldn't be assigned any patient that requires specialized care for cardiac ICU. And this is all you need to know for assignment. You see, you just make it easy, straightforward, and then focus on that information and then use it to answer every question.